Hello everyone, welcome to the question bank. Today we have a very interesting case for you. A 26-year-old male was admitted to the intensive care unit following a road traffic accident, and a diagnosis of a traumatic brain injury was made through a CT scan. 30 hours after admission, the patient's temperature was noted to be 38.5 degrees Celsius. Cerebrospinal fluid analysis, blood cultures, complete blood count, urine analysis, and urine culture were all normal. Which of the following areas would most likely contain a lesion? So now how do we approach this question? First of all, always look at who the patient is. We have a 26-year-old male, so a relatively young patient in the intensive care unit, which means the degree of the condition is pretty severe, right? And we know the cause, which was a road traffic accident, and we know the disease as well, traumatic brain injury. But now there is a new development. He's noted to have a fever. When we think fever, we immediately think possibly infection or inflammation, right? However, the question also tells us that CSF analysis, blood cultures, complete blood count, urine analysis, and urine culture were all normal. So pretty much all the basic investigations that would cover infection as well as potentially inflammation are all normal. Specifically, they want to know your anatomy for this, your neuroanatomy in this question, because the question asks, which of the following areas would most likely contain a lesion? Now, this is a very factual question, so it requires not so much critical thinking, but sort of recollection and retrieval of knowing what the function of the different parts of the hypothalamus are. So let's quickly go through what would be the functions of the hypothalamus. So we can eliminate as we go. So for example, with the lateral hypothalamus, we know that the lateral hypothalamus essentially controls hunger. So we know this is to do with hunger. Okay? So obviously this would not be related to this case. So we can cross out the lateral hypothalamus. Next, we come to the arcuate nucleus. Now the arcuate nucleus is actually a complex structure. It is a collection of neurons that basically secrete various neurotransmitters and neuropeptides, so it has a multitude of functions. It also does have a function in food and food intake. It is the neurons in this from this nucleus are inhibited by leptin and insulin, and they are activated by ghrelin, which means if they're activated, you feel hungry, you want to eat more. If they're inhibited by leptin and insulin, you feel less hungry and you eat less. So we know that, again, this is not to do with feeding. We know this is, because of the temperature of 38.5, we know this is a thermoregulation issue, which means that we can cross out the arcuate nucleus as well. The posterior nucleus, now this gets tricky because we know that the posterior nucleus of the hypothalamus is involved in temperature, right? So this is a possibility. We will come back to this. The paraventricular nucleus of the hypothalamus, option D. Now this is involved particularly with the posterior pituitary gland. The neurons that project from the paraventricular nucleus actually secrete two key hormones, oxytocin and the antidiuretic hormone, also known as ADH. We know that both oxytocin and ADH does not have a role in thermoregulation, in the change of temperature in the body. So we can cross out option D. Now, option E, anterior hypothalamus, also plays a role in temperature. So, how do we know if it's the posterior or the anterior? Now, the best way to do this is essentially looking at which one cools the body, which one heats the body. The normal function of the posterior nucleus is heat-producing reflex, which means it causes vasoconstriction, it increases body heat. But in this question, they're asking which of the areas has a lesion. So if there's damage to the posterior nucleus of the hypothalamus, it would not cause elevated temperature, it would cause decreased temperature if damaged. So therefore, we're remaining with the anterior hypothalamus. If damaged, it would cause an increase in temperature. And therefore, we have our answer now. In this patient, the most likely area of the lesion would be the anterior hypothalamus. Hope you found this useful and stay tuned for further videos.